And we move on to the next speaker, who's Dr. Vikas Veerwal, who's speaking to us on DASP delineation technique with novel release sign for correct plane identification in smile surgery.
Good afternoon, everyone.
Swapna is the discussant. Dr. Swapna Nair, the famed refractive surgeon in Kerala, is the discussant.
Good afternoon, everyone. I'm happy to be here to present a new technique that will make smile surgery a piece of cake for even novice surgeons. So as we all know, smile surgery has marked the paradigm shift significantly from flap-based LASIK procedures to flapless surgery, but it comes with its steep learning curve and challenging complications, especially for novice surgeons. Most often, the complication that occurs is lenticule misdissection that results in nightmares for the surgeon and poor outcomes for the patient. So in a conventional smile surgery, you have two areas of delineation that are done, one on the right side and one on the left side. The two areas are one for the anterior plane and one for the posterior plane. But with this technique, there is significant risk of having initial unindented posterior plane delineation resulting in cap lenticular adhesion. So to overcome this, we present the double anterior single posterior delineation technique with a novel release sign which we have described. In this technique, we suggest you have two areas of anterior plane delineation on right and left sides with a central area of posterior plane delineation. We recommend differential entry maneuvers for anterior and posterior plane delineations. For the anterior plane marked by the red arrows, you see the instrument entering between the cap edge and the lenticule edge, which we can see here in the video, and then the dissector is curved inwards towards the anterior plane. Now, as the anterior plane of the lenticule is in continuation with the undersurface of the cap, with this maneuver, you are highly unlikely to enter into the posterior plane. So on both these sides, with using the same maneuver, you do anterior plane delineation, leaving the central area. Now you do the posterior plane delineation centrally, and here the entry is straight in with slight posterior pressure on the cornea. So this makes sure you enter into the posterior plane. And when you are doing posterior plane delineation, you see resistance on both the edges, which has been described as stop sign previously, but we call it the double stop sign because you have a double stop on both the edges. This gives you reconfirmation that both the initial delineations were in the anterior plane. And now, after you have noticed the double stop sign, you can start with the anterior plane dissection from one of the sides. Now, when you do the anterior plane dissection from one of the sides, as we will see in the video ahead, that you take the long dissector from one of the areas where you have delineated the anterior plane, and as you move across and cross over to the other anterior delineated area, there is a sudden release of resistance because that area has already been delineated. This you can see here again, that as you move across towards the other area of anterior delineation, there will be a sudden release of resistance, and you can see that coming here. So you can clearly see that this gives you another confirmation that your initial delineations were in the anterior plane only. And when you do the posterior dissection, you don't see any release sign because there was only single area of posterior delineation that had happened. Now, following your dissections have been completed and you have confirmed they were correct, the rest of the surgery is proceeded in the normal fashion. Now, we performed this surgery as a novice surgeon with less than 5 cases of experience and did not have any lenticular misdissection in 60 cases. And the advantages of our technique is that it's very simple, easy to adapt, and is very repeatable. Can be equally safe in even low myopia patients. And also gives an opportunity to rescue because you have two areas, at least one is likely to be correct for anterior plane delineation. But the biggest advantage is for the surgeon is the multiple checkpoints that it provides. The first checkpoint being the differential entry maneuver for anterior and posterior plane dissections. The second checkpoint being the double stop sign, and the third checkpoint being the release sign. So you have 3 checkpoints that assures you. So to conclude, with our technique of DASP delineation, both the surgeon and the patient are going to walk out with a big smile on their faces after every smile surgery. Thank you.
Nice. Very
yeah, that was a very comprehensive presentation. So did you compare it with, the first 60 eyes of that a novice surgeon has done normally with compared to what you have advised?
No, because as these all 60 eyes, I'm talking about me as a novice surgeon when I had less than 5 cases of experience. Firstly, it would be, not a proper comparison, because if there are two different surgeons for the two different types of surgeries, then you might not get the same results. And yes, one of my colleagues who was starting with me did have at least 2 or 3 cases of lenticular misdissection where the senior had to take over because the posterior plane was
In the first 5 cases you did you find it harder than when you
I
started
found
doing
it
this?
harder, and I was always uncertain because the signs which have been described previously, they're not easy to identify. The meniscus sign and the other signs that have been described are not easy to identify. So I found it difficult, and I was always uncertain and looking over to my optometrist who was more experienced, that am I in the correct plane? Am I in the correct plane? So once I started doing this, I was very certain that I am doing the dissection in the correct planes only.
So you had no problems by cutting through the, in low myopia cases through the lenticule?
Not at all, because there were two areas, so you were very certain that you are doing it correctly.
Thank you.
Thank you.